Good afternoon and welcome to our daily COVID briefing. We apologize for being a little late joining you here today, but a lot of things going on, busy day here. I'm joined with Chairman Kern and Samantha Bierman from the Health Department's back with us today. Sam, taking a minute away from the fairgrounds. I know
Yes.
Herb and Myler are still down there dealing with stuff, but thanks for joining us today.
Absolutely, happy to be here. So as of today, we have tested 282,941 St. Clair County residents, which is an increase of 1,461 from yesterday. We have 27,820 positive test results, which is an increase of 63 from yesterday. And that does include both males and females from under the age of 10 up to their 80s. And today, our daily county positivity rate is 4.3%. And we are at 255,121 negative test results. We are announcing no new additional deaths today, so we do remain at 445. And for those who have completed the IDPH required 10-day isolation period, we are at 26,812. For state totals, 17,895,829 have been tested, with 1,181,226 positive test results, which is an increase of 1,884 from yesterday. And for deaths, the state is reporting 20,406, which is an increase of 32 from yesterday. For our hospitalization numbers in St. Clair County, currently we have 65 patients that are admitted due to COVID-related reasons, and 2 of them are on ventilators. Regionally, we have 100 patients that are admitted due to COVID-related reasons, and 7 of them are on ventilators. We have no new changes in our congregate living and long-term care facility status outbreak numbers, which is always a good day. And now I will turn it over to Chairman Kern for his update.
Thanks, Sam. Busy at the fairgrounds.
Yes.
And really, the key is people need to show up when their appointment is. There's a reason why we schedule appointments. You need to show up when your appointments are scheduled.
And we understand that there have been some news outlets lately covering the fact that some health departments have not received their second doses for those individuals that were ready. Please be rest assured that that has not happened to us. And if you are able to make an appointment on our scheduling website, that does mean we have a vaccine for you. So please come as close to your scheduled time as possible, because if we have an influx of people coming all at once, it just creates chaos. So please, like I said, do be rest assured that if you get an appointment, we do have a vaccine waiting for you there.
It creates traffic jams.
Yes,
And,
to say
and
the
that's
least.
what we don't, we have enough capacity to handle a lot of cars in the fairgrounds, and we have a lot of queuing that goes on, but when we had people today show up for a 6 o'clock appointment, a 6 p.m. appointment at 9 o'clock in the morning, and when you show up at like that, it throws all of the traffic patterns off, and it makes it far more difficult for that person who had a 9 o'clock appointment to be able to get there. So just like if at your normal doctor's office, you don't show up at your doctor for a 6 p.m. appointment at 9 o'clock in the morning. You wait for your particular appointment time. So we ask that you do that. You would not, and as we've said this in the past, you would not have gotten an appointment if we did not have that dose ready for you that day. So just like we want you to show up on Thursday when you have a Thursday appointment, that's because we know we have all the doses for all the appointments on Thursday. We also ask you to show up at your appointed time. And if you do that, the whole schedule will be smooth. It's been smooth since the beginning of February. We have not had these traffic issues, and we had them today because a lot of people, I believe it must have been a lot of people looking for second doses that had appointments and were worried that if they didn't get there, they might run out. We're not going to run out. We're going to be going till 8 o'clock tonight. We have all the vaccine we need, so show up at your appointed time, and you won't have to wait in line. Everything will be, and your neighbor won't have to wait in line. It'll all be in a very orderly fashion. So that's what we ask.
Yes, and that aside, it was a great day. We still have several more hours to go before the day is done. But our nurses are doing a great job. The Illinois National Guard is doing a great job, and it's really coming together as a whole. And we're excited to see, what we can push the boundaries to with this drive-through. We are scheduled to do not 10,000, 2,000 today. And we're anxious to see how that looks throughout the day as our numbers keep increasing.
Right.
Sam, just a quick point on there. Something we heard a lot down there today. Can you touch base real quick on just because your vaccine card says you're due today
Yes.
does not mean you've made an appointment?
That is correct. So if you are coming for a second dose, whether that be Pfizer or Moderna, you do still need an appointment. So just because you may have gotten a reminder on your cell phone or you have your vaccine card, that does not automatically secure you an appointment. You will receive an email or a text message, most likely an email, to sign up for your second dose just like you did your first. So you will still be required to make the appointment yourself, pick the correct day and time. And as a side note to that, when it does say 21 or 28 days, that is simply the minimum amount of time you have to wait. So let's say that you have something going on for the next 3 days and none of those appointments that we have out there work for you. It is still okay to schedule your second dose on that fourth day. Those are simply minimums that the CDC and both drug company groups have put out there.
Right, and there are some that say, that timeline is much longer than 4 days. You could be a couple of weeks after.
Correct.
You want to get it as close to that date as possible,
Exactly.
not before.
Correct.
But if we don't have, like Moderna, maybe in short supply right now, so if we don't have the Moderna to do the second vaccine, then if you would show up, or we would not make your appointment. And so you shouldn't just show up. You need an appointment to be there. And that card was given to you. You need to bring it when you come for your second shot. But you've also got to have an appointment at that time so we know to get you through the line.
And we don't want anyone waiting, let's say through all that traffic to get up to the front thinking they have an appointment. That would be very frustrating, rightfully so. But anytime you are coming for your first or second dose, you or someone, that perhaps maybe in your family or a neighbor who might be more tech savvy than you can help you schedule, but you do need an official appointment to come to both doses.
So you need an appointment, and you need to come when your time is scheduled.
Exactly.
And you'll get your shot, and it'll be smooth, and we'll be able to get rid of this COVID-19. So let's move into the zip code report for today. 62201 is up 1 today to 558. 62203, we're up 1 to 591. 62204, up 2 to 378. 62205, up 1 to 617. 62206 is the same today at 1256. 62207, up 1 to 566. 62208, up 4 to 1562. 62220, up 5 to 1977. 62221, up 8 to 2,683. 62223, up 6 to 1,676. 62225, up 1 to 137. 62226, up 8 to 3,065. 62232, up 3 to 865. 62243, up 2 to 735. 62254, up 1 to 784. 62258, up 1 to 1,007. 62269, up 11 to 3,141. And 62285, up 3 to 548. 63 new positives today, 1,461 tested. Makes our daily county positivity come in down today at 4.3%. Rolling average stays the same at 5.8%. Regional positivity ticks up today to 4.3%. And that's derived by Bond County at 2%, Clinton County 1.9%, Madison County 5.3%, Monroe 9.9% today, Randolph 0.7%, St. Clair 4.4%, and Washington County 6.1%. So have an appointment, come at your appointed time, and have a little patience. Everybody's going to make it through the line. Everyone wants to get, that's in line, is there for the same purpose. They want to get the shot in the arm. And so we just need to work through this. At some point, everyone's going to have this shot. We're not going to have this problem anymore, or at least everybody that wants to get the shot will have one.
Absolutely, and be understanding of others. You know, we've talked to a lot of the people that live in the neighborhood today, and we apologize to them that you know there's excess traffic on their road that they're not expecting, and it's not something we plan for. There's definitely not a traffic pattern that includes routing cars through those neighborhoods, and so we definitely want to apologize to those people that live in that neighborhood. But we have a good plan. The plan works. We just need a little consistency from those coming.
And we heard a story that there was an elderly person that was confused, and they unintentionally cut in line at one point, and the person that got cut off was angry about it. And everyone is going to get a shot. It's all going to be fine. We're all going to work through this. So let's have a little compassion with our neighbor, and we're all going to make this work. Everyone is trying for the same thing. We're trying to get rid of the virus so we can get our lives opened up again. This is a huge undertaking to be able to vaccinate what likely is going to be close to 200,000 people in St. Clair County. And in order to do it and not have this virus keep morphing into new strains, we've got to do it in a timely fashion. And so if we can get 2,000 people done a day, which is what looks like we're on target to do today, that's a far shorter timeline to be able to eradicate this virus than I think what many expected. So let's just have some patience. We'll get this done, and we'll get our lives back to where they need to be this summer.
Absolutely. Chairman, I couldn't have said it better. We thank everyone for joining us and being with us here for the last 349 days as we provide you this information. We look forward to the day when we have eradicated this virus from here, and the daily briefings are not a necessity, and we're here to tell you everything is back to normal. But until then, we're going to be here. We're going to be giving you that information, the good, the bad, everything about it. We thank you for following. Cindy will not be joining us today, so we will not have that Spanish translation, but we will be back with you tomorrow at approximately 3:30 for day 350. Thank you for joining.
I was born and raised in East St. Louis, St. Clair County, City of Champion. We band together like family on picket where the Mary Brown Center in Lincoln Park was my playground. Just as we were together then, we must all band together now and work to combat COVID-19. As an Olympian, I understand the importance of teamwork and overcoming hardship. So I plead with you to do what I'm doing to fight this virus. Wash your hands, wear your mask, watch your social distance. It takes teamwork, and if we stick together, we will victoriously cross the finish line.